Ladies, we're meeting you where you are. It's the Dare to Ask podcast, episode 6, Fertility Truth Bombs.
Fell in love with a field that's constantly changing. It's such a privilege to be with couples to help them start their families.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that dares to ask.
We're here to make a connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
Exciting is that we're just getting better and better all the time, and more couples are having success, which is what we want.
So there is so much more to the clickbait about the ability to have children than meets the headline. My special guest is a fertility expert. Dr. Stephanie Dahl draws this enlightening comparison to cholesterol and infertility and how they both can be genetic as well as self-induced. Believe me, listening to her explain it makes so much more sense. And she has a number 1 no-no for women who want to avoid fertility issues. It's a big baddie that can be devastating to your fertility health. And also, she uncovers the question about men's fertility that she gets all of the time. And one of the things I was super curious about, all of these current at-home fertility tests that are being pushed on social media, are they really helpful? Or should you just save your money? We find out what a changing field fertility is, and I'm excited to do it. So let's get to it now. What do your friends call you?
Stephanie.
Do they call you Stephanie? Mm. Okay. Am I good to call you Stephanie?
Yeah, yes, of course. Yeah.
We're going to get into the fertility game here today. I've got some questions that I'm going to ask you, and kind of why we call it Dare to Ask is because sometimes it's good to just get it out there, or maybe the uncomfortable question that when put on the spot. We're embarrassed to ask our own doctor or our own provider sometimes, and it's just so silly because I'm sure you have this and you go, just ask it.
That's 100% true. People do feel embarrassed to ask questions, and we hear questions all the time that maybe not your normal question. So nothing is embarrassing to us.
Yeah, nothing's off limits.
That's true.
You want to hear it. I want to know a little bit more about you as the person, as the woman. Do you have a family?
Yes, I married my husband, Joel. We have been married for 25 years this summer.
Congratulations.
Yeah, thanks. We met at NDSU. Been together ever since. We have 3 children. We have an 18-year-old who's at the University of Alabama this year. So,
oh, wow.
First time having a kid in college, and that's been interesting and exciting. We also have a sophomore. He is 16, and I have a 6th grade girl.
Oh, wow.
Yeah,
yes.
So it's fun. They're busy, active. We've been in the hockey scene. We've been in the basketball scene with our sons, and now my daughter is a gymnast. She competes at TNT. So,
fun.
Yeah. And my son that's still home, he competes in archery, which is a really interesting and fun sport that I didn't know much about until he started showing an interest.
Your kids come along and your whole world opens up to
Absolutely.
A whole lot. It's like in some ways they go through these activities or sports and you're living them all again for yourself.
Yeah.
But just like you said with archery, it might be something brand new.
Right. Absolutely.
I'm the furthest thing from hockey mom. I don't know and which is so strange up here because I feel like everybody plays hockey, but none of my kids have ever shown any interest. So clueless about the hockey game. I would be clueless about archery as well.
To learn about hockey and soccer too.
Yeah.
My oldest son played soccer. So yeah, it's fun though, and keeps them busy and occupied. And
Now with a son all the way in Alabama, are you at all hopeful that maybe the next one in line is going to stay a little closer to home?
Yeah,
or do you not mind?
Don't mind. That's where he wanted to go and that's where his interests were. But, we're also huge NDSU fans and we tailgate and we went to Frisco and go to as many games as we can. And we're also Vikings fans. And so we enjoy football. And so it's been fun to watch the Alabama football games.
Yeah.
He loves it there. So he needed to find out what was a good fit for him. And
congrats, Mama, because it's hard to let the kids
Fly from the nest. It is.
Okay, when it comes to social media, are you active on it?
Oh gosh, not a ton. I mean, I have a Twitter account, but at least several months since I've checked it. So I would say not super active, unfortunately. We have Facebook just with family and friends, more to keep up on, how everyone's doing. So I have to say I'm not super active on social media like I know some physicians are.
It's a sword, right? I mean, it cuts or you love it. I mean, it just feels weird for me to even say this. Now I love TikTok. I thought there's no way I belong on TikTok. I am quote, too old for that. And now my mind has completely changed. It's very entertaining. I love it. The fertility talk on TikTok is now a thing, and people are getting information out there. Just like any social media, you're hoping that it's the right information. What's a common viral trend is to say, what have you heard about blank? And it's usually a lie or a myth or something. And then the person says, I'll go first, and then shares the first one. And then it ends up people going back and forth. So I kind of wanted to do that with you with this field a little bit today.
Sure.
Kind of get at the crux of what are people still believing, questions they might have. What is something that you've heard about fertility that was a lie? And I'll start, and my thing is this. If you have fertility treatments, you'll have multiple babies.
I've definitely heard that, but it's definitely not true, especially these days. So when I started in this field 18 years ago, especially with in vitro fertilization, it was common to transfer 2 embryos, sometimes even 3 embryos. And that I would say has really changed. And keep in mind, success rates back then were not great. Yeah. So we would transfer 2 or even 3 embryos and have success rates in the 30%. Now we transfer 1 embryo and get success rates closer to 60 to 70%. It's safer to transfer 1 embryo. It's better for mom. It's better for babies. We see a higher risk with pregnancies with twins and higher. And so whenever possible, we always want a singleton. And I think nowadays it's much more common to cancel cycles for IUIs or even someone who's using Clomid or Letrozole to help them ovulate if they have irregular menstrual cycles. And so if there's too many follicles and we're concerned, we will cancel cycles more regularly than we used to in the past.
Yeah. I mean, my mind gets boggled at the evolution. As
it's amazing.
You've been in 18 years.
Yes.
So what was the game like when you got into it? Where was the passion where you're like, I'm going to be a fertility specialist?
Yeah. Well, it started actually in med school. I thought I was going to be a pediatrician and just fell in love with women's health and obstetrics and gynecology because all reproductive endocrinologists start as OBGYNs. So delivering babies, I absolutely loved. It's really a privilege to be with a couple at that moment in their life. And it's such a life-changing moment. So that I really loved women's health and delivering babies. And then when I started rotating through reproductive endocrinology when I was a resident, found that for couples who are struggling to get to that point, that was even more satisfying to help them reach that point. And just fell in love with the field. It's constantly changing. It's such a privilege to be with couples to help them start their families and give them that hope and be with them, through that journey to even start a pregnancy.
What excites you about all the changes? You're just like a little kid on Christmas morning.
There's so much that has changed since I started in this field, and especially with in vitro fertilization. The thing that's most exciting is that we're just getting better and better all the time, and more couples are having success, which is what we want. I came into this field because I want every couple to be successful and to have their family at the end of this. And so I'm truly invested in each couple, each family, and want them to be successful.
Yeah. I've never had a struggle with fertility per se, but the thing that excites me about what's happening, the evolution that I've personally seen, is now we're at a place in science where there's more proactive. It's less sad. Feels like there were so many couples even a decade ago where if you were seeing a fertility specialist, you had so much disappointment and loss already. But now there is this evolution of people being proactive.
Absolutely.
And so there's this empowerment now.
Before, cancer treatments for fertility preservation was really the only reason we thought about freezing eggs. And now we're thinking about maybe for someone who we can do fertility testing and find at a younger age that they may be experiencing problems 5 or 10 years down the line, and we can act now to preserve fertility. It's not just for cancer patients anymore.
Maybe you're going in as a very healthy 23 30-year-old woman, but with the knowledge, let's say mom or an older sister has had some fertility issues, we now have that ability to go in and see the health of our eggs, not because we're ready to start our family now, but because you want to be prepared, let's say a decade from now, to have the best success rate. Empowerment of going, this is good. I feel in control of my future.
Absolutely. And it's just not something that was really available even 10 years ago because the technology to freeze eggs was not good and it wasn't an option like it has been to freeze sperm for decades and to freeze embryos. So it is an exciting time. And like I said, technology keeps getting better and better. And
what is the shelf life? If I were to freeze some eggs today, how long would those be good? How does that work?
We know that the longest surviving frozen embryo that was thawed and resulted in a healthy pregnancy is 26 years. But the technology for freezing eggs, what we call vitrification, has not been around as long. And initially, like I said, it was mainly used by cancer patients. And so we think at least 6 to 10 years, but the data still is not available.
Yeah. But you're feeling comfortable with that 6 to 10?
Yes.
Like to be able to say, well, in 20 years, come back. We're not at that point.
We're not at that point yet. And part of it depends on the health and the age of the female when her eggs were frozen. So someone who is freezing eggs at 41 may not have the same type of success as someone who's doing it at 31.
Yeah. If you are unfamiliar with your own health history and the biology that women go through and the eggs, unfortunately, it just seems so unfair yet because we can't change biology. Science can progress, but our bodies, we have that window of opportunity that's supposed to be the best prime time to have our babies. And it seems so unfair because many of us don't live our lives like that.
Exactly. And that's what's really changed probably over the last few decades is that women are waiting to have children until they establish careers or maybe just till they find a partner that they are comfortable with. And so because of that delayed childbearing, we do see that there are more fertility problems. As women get older, their eggs get older. Actually, women are born with all the eggs we'll ever have in our lifetime. And that's different from men. Men start making sperm at puberty and constantly are making new sperm. Yeah. And so men really don't see that age-related infertility that we can see in women. I was one of those women who waited till my career was established, and we did have some struggles and ultimately were successful. But that can definitely impact how we're looking at fertility long-term as well. And I think women here on Entertainment Tonight or, they see on People that someone had a baby at 50, but they may not realize that they used frozen eggs from when they were younger or frozen embryo or maybe donor egg. And so they're kind of a misperception that you can continue to have children at age 46, 47, 50. And we can, but sometimes it takes other options.
Yeah, a lot more intervention potentially. We only see the headline. We've got the clickbait and go, oh my goodness, Sofia Vergara had a baby at 50 or Janet Jackson had one at 51. And easy peasy, no big deal. They're just blessed. Well, I mean, fertility issues can start very young for some people as well.
And that can be genetic, just like you often hear about cholesterol. Part of it's what you inherited and part of it's what you eat. Same with fertility. Part of it is what you inherit, and women can inherit genes that they don't even realize, things like galactosemia or Fragile X syndrome that can affect their fertility, and they don't even know that they're potentially carrying these genes. And then part of it is exposure. So I guess probably the biggest thing I would want young women to know is don't use tobacco products. Those are very detrimental to egg health and fertility. And I just don't think it's anything you really learn about in health. You learn about lung cancer and heart disease, but you don't hear about how devastating it is to future fertility. So if I could go around and talk to high school girls, I would say just don't smoke ever. Don't use tobacco. Don't vape, because it really does affect fertility. We see women who use tobacco have menopause at a younger age. They have more fertility problems. We have a higher risk of ectopic pregnancies, birth defects, tubal factor infertility. Tobacco is really detrimental to fertility.
Dr. Dahl, just dropping the truth bombs here today. You just have the one daughter.
I have one daughter.
And she's 6th grade. So are you talking about this stuff with her? It feels so young.
Absolutely. And she, like any other tweenager, preteen, does not want to talk about any of those things with me. And my sons did not either. But yeah, I think it's important conversations to have.
It's like how you treat your body now can actually affect your future. And you don't even have to know what you want in the future yet, but just know, taking care of yourself, it's only going to help you in the long run.
Absolutely.
I have a couple other questions for you. Something that you've heard about fertility that was a lie. Here's another one, that it's just mainly a female problem. We were born with all of our eggs, but men after puberty regenerate new sperm all the time. Is it really mainly a woman's issue?
No, about half the time there's a male factor involved, depending on what data you look at least 40% of the time. I think another big myth is if a man has had a prior pregnancy or a previous child that they don't need to be tested, and that's absolutely not the case. Just like women can develop things that affect their fertility, as men get older, they can develop maybe diabetes or thyroid disease or other things like high blood pressure, or sometimes just medications that they're on can definitely affect sperm count. So if a man has a child and maybe that child is 8 or 9 years old, it used to be thought that you don't need to check sperm count on him, but now we know that absolutely that should be evaluated. Both partners need to be evaluated.
Wow. What are some of the things that men could be doing with their health that is going to hopefully give them the best success rate?
Well, again, tobacco. We find that cigarettes, vaping, cigars, chewing tobacco, all of those things definitely affect fertility. And if we can get men to quit tobacco, that makes a huge impact. Any other like environmental exposure, so things like marijuana or illegal drugs, alcohol can affect the sperm. So we usually say try to keep it under 4 drinks per week. Those are all real important. Sometimes just occupation, like men who are sitting for long time periods, like long distance truck drivers comes to mind, more heat and just that long time period of sitting. I think that can affect the sperm, especially how well they're moving. Men who have a lot of exposures to things like oil and gas or solvents, things like some of the oil workers or even mechanics, we think that can affect the sperm. And then just nutrition too. I think it's so important to get the 5 to 6 vegetables and fruits per day and getting the green leafy vegetables like kale and spinach and broccoli, and getting fruits that are, especially those dark fruits like blackberries, blueberries that have lots of antioxidants. Really important for men and for women. And adequate exercise, that's important. So just our general health, it's important for our general health, but it's also important for fertility. Getting good sleep and, exercise and a healthy diet all play a big important factor.
Okay, so I'm going to dare to ask this because one of the things that you didn't mention, and curiosity, I got to ask it. How often does injury play a part for men? Because let's go back to recess or playing football or, somebody took a shot, if you will, right? An accident, errant ball hits a male.
Yeah.
That actually a risk?
Most of the time, probably not. If it's a severe injury, it can be. There is something called the testicular blood barrier. And even though a man makes his sperm, the body recognizes them as foreign because they are slightly different genetic makeup. And so the blood and the sperm or the testicle should really not come in contact because men can develop something called anti-sperm antibodies. And that's more common after a surgery. So for example, like someone who potentially had a testicular torsion, which is when a testicle can twist and it's extremely excruciatingly painful for men. But the surgery to correct that then can cause long-term issues. And it needs to be corrected, of course. Or vasectomies, vasectomy reversals, those are real common places. So probably a little less common with a football injury, especially even boys are wearing, protective gear. Definitely it's possible.
Okay.
It's a great question. I get it all the time.
What is the success rate for reversal vasectomy?
Mostly it's urologists who are doing those. And so it depends on the time period from when the initial vasectomy was performed. So vasectomy reversal within 2 years is the most successful. Also depends on where you go for your procedure. So usually I defer those questions to urology, but fairly very successful within 2 years. Within 5 years, it goes down a little bit because of those anti-sperm antibodies. So even if the tubing can be reconnected, sometimes the sperm are not moving as well. They have motility issues where they're sticking to each other rather than going off to find the egg. And then for men who've had a vasectomy over 10 years ago, then the success rates are quite a bit lower.
Yeah.
So it's really the duration of time from the vasectomy reversal to the vasectomy.
That's really good information to have. I'm sure you get to cover all of those gamuts when you have couples come in and start talking about this stuff. What is your feeling and opinion on the at-home tests that women are doing? They are growing in popularity for a lot of hormonal tests, Is it simple blood work that is done to find out even the egg count?
So there are some simple tests you can do that send off type kits for men and for women. I find that probably for the most part, they are helpful, but definitely some of them are not reliable. So we've seen semen analysis that have been done for men that are supposedly normal and they're not normal. And keep in mind, if we're doing a semen analysis in the office, we usually want to look at it for within 30 minutes. And if you're sending these off, it's days delay.
Gosh,
So not necessarily accurate. And some of the companies that do the at-home testing for the female hormones are reliable, and then some of them aren't super helpful. So I would say if it's something you can do in the privacy of your own home, a lot of people just prefer that and get some initial information. But if you get results that you're not sure how to interpret, follow up with your regular physician to do additional testing.
Kind of goes back to that empowerment thing. If you are in your 20s, if you're even still in college and you're like, well, this is something that I can afford and I have control of this, that knowledge would be power, because maybe it would take one of those simple tests, probably more eye-opening, see a problem, make an appointment. Do you see single females?
Absolutely.
You do?
Yeah, we see single females all the time. Some who just want to do fertility testing. We see them for fertility patients, cancer patients for fertility preservation.
Yes.
See a lot of young women for that. Women who just want to start a family on their own and use donor sperm to just start having a family without waiting for a partner.
What are the risks right now for the baby when it comes to fertility? Is it a higher risk pregnancy automatically if you have had fertility issues?
Not necessarily. In vitro fertilization does put women at a slightly higher risk and usually are followed by high risk OB. But the birth defects are really similar to the general population. We do, like I said, tend to see more twins if we're using ovulation induction medications where we can't control how many fertilized eggs implant. Still, like I said, we cancel more frequently, so it's not as common as what we saw 10 years ago. But if there are twins or triplets, then definitely they're going to be followed by the high risk OB doctors.
Yeah. Is there any practices that you do in your regular daily life to keep yourself healthy, even if, you're not future planning for children? But from that woman's perspective,
I think exercise is the key to longevity and the key to just being healthier and happier. I think making that commitment to yourself. And as moms, we are so busy and we put the kids first and we put getting them to soccer and to hockey and to gymnastics and getting supper and doing laundry and all the things you have to do just to keep every day moving forward and to keep up. But if you don't put yourself at a priority, make some time for physical fitness, I think long term everyone suffers. And I think mentally, emotionally, people feel better after exercise. They have that time to regroup. And so, I'm a huge fan of actually Orange Theory Fitness. I don't know if I can put a plug out to them, but
all you want, honey.
Yeah,
I've done OTF a time or two, and it is a great workout.
It is a great workout. I love that there's a coach there that it's motivating. I have a treadmill at home, but I tell you what, I get a better workout with Orange Theory Fitness. Obviously, it's not something that maybe everyone wants to pursue. So, but whatever it is, if it's even a 30-minute walk with your spouse or your child or your dog or your friend, or which is hard to do in North Dakota in the 20 below weather, but West Acres, walk around West Acres Mall or go to the Rested Recreation Center or somewhere that, Quartz Plus that has a track or whatever it is that you enjoy, if it's swimming or yoga or solid core or any of those, workout places. Just, I think, making that commitment to yourself so that you can be healthier in a better place, like I said, emotionally and physically, so that as your family grows, you grow with them. Exercise has been shown to be one of the best things for long-term health as well.
Yeah. It's one of those things where we all know it, but it just has to be said and encouraged and reminded on, just to keep on keeping on.
And knowing that your health is more important than doing 2 loads of laundry.
I want to talk timing here. When you see patients who are going to start some sort of intervention with their fertility, what is the timeline typically, or what's your average? How long from the very first visit where they know an intervention is necessary to I've got a sweet little babe in my arms?
Gosh, that's a great question. It really varies. For the female patient, the workup really depends on where she's at in her menstrual cycle. So sometimes if there are tests that we need to do and hormones we need to check, we usually like to do an ultrasound and potentially check the fallopian tubes. And all those are dependent on where you're at in your menstrual cycle. So if someone comes in and their cycle day 15, we might have to wait 2 weeks for them just to get their period so that we can start getting getting the hormones and the testing done at the right time on the menstrual cycle, which is different for men. We can really check a sperm count almost anytime, ideally 2 to 3 days after intercourse, but we don't have to wait 2 weeks to get them in to even start a workup. So part of it depends on the workup and what we find. Typically, IVF is our last option. We always want to do something that's cheaper, easier, less invasive, less expensive. But sometimes we know we need to go right to that, potentially due to a severe male factor infertility, or maybe fallopian tubes are blocked or something else. So usually that's our highest success rate as well.
Oh, okay.
But it does take a few months to do an IVF cycle. So, I would say most patients, by the time they get to us, they've already been trying for 6 months to a year and want to move forward pretty quickly, and we'll get them in and try to start at least getting answers very quickly. The really fun, exciting thing is sometimes just the process of doing the evaluation can help increase your chance of pregnancy.
Yeah.
There is a test called an HSG that we use to evaluate the fallopian tubes, and when we do an HSG, it actually cleans out the fallopian tubes and increases a woman's chance of getting pregnant. So sometimes we'll start the workup and then we get success even just from some of the testing that we're doing initially. So that's pretty exciting when that happens.
You think, I always have my period every 28 days. How accurate do you really know?
And that's a big thing too. Some women who are not having regular cycles, so if they're having a period every 60 days or 90 days, or maybe it's not even something that they can quantify or count, it might be 28 days and then 50 days and then 37 days. Don't wait a year. Get in and let's start getting this figured out, because there's an underlying issue we can address and decrease that time and frustration level, because that's a really frustrating issue when periods are irregular. So in general, we say if women are under the age of 35 and are having regular cycles, we can do an evaluation at a year. If women are 35 to 40, we typically say 6 months. And at age 40, we typically say 3 months. And that's all for women who are having fairly regular cycles and regular intercourse. If we know that there's an underlying issue, for example, someone's 34 and they know they have a history of severe endometriosis, let's get you in sooner so we can talk about things, because we want to make sure we're getting workup done in a timely manner.
That perception for so many people, it can be very eye-opening. You might be shocked by the process taking a little bit longer, because wouldn't you say that you want a year of trying before an intervention happens?
Yeah, if you're healthy, otherwise having regular cycles, no major issues in your history, it can take up to a year to conceive naturally.
Do you think that women and men are disappointed sometimes by that news, that they would like the intervention? Because hello, we're Americans around here. We want the gratification. So fast.
Now, I see both sides of the spectrum. A lot women who come in and they want to start the testing sooner, which is absolutely fine. If someone feels like, okay, I just want to make sure there's not something else going on, and if we can do that HSG and clean out the tubes, you don't have to wait a year. If someone wants to start getting answers sooner, we absolutely can start that process. And then sometimes we find people who are way on the other end of the spectrum. They've been trying 10 or 11 years without success. And I would say at that point, we definitely want to get them in and get some testing done and try to figure out what's happening.
You're going to expedite to get those answers. Long-term fertility treatments. How many rounds of, say, IVF? What's the average there? And then what is the limit?
Great question. So the bigger changes probably come with IUIs. When I started in this field, 15 years ago, we were routinely doing maybe 6 or even 9 IUIs. And now the recommendation is really, if we haven't had success with 3 IUIs, to move on to in vitro fertilization. And that's a recommendation by the American College of OB-GYN and the American Society of Reproductive Medicine, just because success rates and trying to decrease that time to conceive.
When did that change?
Maybe at least 6 or 8 years ago.
Okay.
Yeah.
So within the last decade is when.
For IVF cycles, I wouldn't necessarily say there's a limit that we put on people, and everyone is different based on their background and their history and their testing. I wouldn't say there's necessarily a limit of IVF cycles that we put on anyone.
It might be an emotional toll that you just know you're done, or maybe it's the physicality of it and going, I can only do so much. Like, there's only so many times I can go through this. Or for others, if you don't have the obstacle where financially it's an obstacle and the sky's the limit.
Majority of patients go through one egg retrieval and hopefully can have more transfers, more pregnancy potential just from the one egg retrieval, but we can hopefully freeze more than one embryo.
How often are you having to share with patients that like nothing is going to work? work?
Yeah, not too often. I mean, even when we are not seeing success with IVF, we still have options. Maybe not the traditional options that someone thinks about, but kind of our last resort would be a gestational carrier, what's commonly known as surrogacy. That is typically a last result. Unless, I mean, I've had patients who've had cervical cancer and hysterectomies, and that's obviously their first option because they no longer have a uterus and still want to have a family. And so we can remove eggs as long as their ovaries are intact, fertilize it with their spouse's sperm or donor sperm, and have, sometimes it's a friend or a cousin or a sister or someone that they've known their entire life who will then carry the baby for them. So that's not uncommon to see that. Pretty amazing process that we can help couples who are even in a situation where otherwise they would not have been able to have a baby on their own.
This field just is amazing to me. If you're a science head, what we're capable of creating, and the sky's the limit. But then on the flip side of it, it doesn't get more personal, more intimate, more relational as well. So you really kind of are double dipping in a gamut of how do you get closer to somebody? You know everything.
Right. Yeah, it definitely is. We get to be very close to our patients. And like I said, obviously want them to be successful because if they're not, it hurts. It's hard for us too. Like our nurses, I get very attached to patients that they work with. And they, of course, are devastated if they don't have success. And sometimes it takes a couple tries. So it can be a frustrating process. But I would say the majority of time we end up being successful. Our success rates are much better than they were 18 years ago or even a decade ago. So that's the good news.
We put so much concentration these days on mental health, which I think is amazing. That's another area where we just keep continuously expanding on and telling people it's okay to put your own mental health at the forefront because it is so personal and you might have loss or you might have some tragedy or some trauma. When it comes to mental health, is that something that with your patients you tell them to spend time on as well?
Yep. And again, I think that comes back to the exercise and adequate sleep and just doing the things that you can control. Supplements we think are important too, especially prenatal vitamins. I think vitamin D, gosh, everyone in our cold northern climate could use vitamin D. And some studies that have shown that it helps prevent COVID too. And speaking of COVID, one thing that I would love to get out today is that I definitely recommend that everyone get the COVID vaccine. There is no impact on fertility on men or women. There have been, I think, close to 200 pregnant women that have died in the United States due to COVID and left behind, a baby without a mom, a grieving partner. So if I can get anyone to get a vaccine who otherwise was on the fence, please do it. It will not affect your fertility. It's the best thing you can do for you. It's the best thing you can do for your baby to keep you healthy. And it's definitely safe and effective.
Yeah. With vaccinating pregnant women was that you were giving this layer of protection for a baby that, up until right now, you'd have to wait until 5 years old before they would be able to get, the vaccine. So
absolutely.
This was a treat. I learned some new information here today. Thank you so much for your time.
Yeah, thank you for having me.
There's a reason why we titled this episode Fertility Truth Bombs, because Dr. Stephanie Dahl, she really dropped some today. Some really good stuff. I appreciated her hard facts when it comes to absolutely no on tobacco use and when you should actually reach out to your doctor about your fertility health. Some great insight, and I'm excited to get to the next bit of insight on the next Dare to Ask podcast.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.